and Lindstrand, who is a pediatrician and a specialist in public health and social medicine. She has worked for 5 years in different African countries with MSF, and since September 2018, she is the coordinator of WHO of the extended program of immunization in headquarters in Geneva. She's going to present a presentation about equity and global immunization during and after COVID. And before handing it over to her, I remind the audience that you can, during the presentations, you can put already your questions in the question box, because then we can like this go through them in the panel discussion. So, Anne, welcome. Thanks a lot, and the floor is yours.
Thank you, Anna. Actually, I don't consider myself as external. You know, I'm still a member of MSF. My heart is still with MSF, even if I have this logo above my head. So I was asked to talk about equity and global immunization during and after COVID. Next slide. So before COVID, many of you know this slide, 9 out of 10 children were vaccinated in 2019 before the pandemic. Fantastic results, actually. However, 20 million children remain or under vaccinated. And the coverage of DTP3 has been staggering the last at least 10 years, leaving these 20 million children outside of the realm of getting access to life-saving vaccines, and half of them about from the Afro region. Next slide. So what we are particularly concerned about are the green parts here. So the 14 million infants that lack vaccine to immunization services fully. So there's 14 million that do not even receive one initial dose. And as MSF, you know very well who these are, where they are. Those that lie outside of access of immunization services, but usually of other health and social services as well, right? In addition, 6 million are partially vaccinated. So they reach for one, but not the full follow-up doses. Next slide. And here is kind of a map of these zero-dose children, which the immunization community is focusing quite a lot on at the moment. The zero-dose that never even get the first dose of DTP. 14 million, as I said, and the majority of them, or half of them, living in Afro. So that's where you have most, but also in the red bubbles, the countries that are considered as fragile, conflict, or vulnerable settings are also overrepresented of these children who get not the same access as before, as others. Middle-income countries are actually more and more overrepresenting here. You have Philippines, Brazil, Mexico, Angola, with large populations of zero-dose children living outside. Next slide. You can skip this one and go to the next slide. I wanted to go over then to what has happened during the pandemic. I think it was fantastic presentations that actually showed this in the last session. What we can see in WHO and UNICEF is that a lot of people have just dropped what they do in immunization in many of our different organizations to pay attention to this largest ever introduction of a new vaccine at never seen speed and scale before. So the slides I'm going to show actually have data 4 days ago. So now we're 125 days away from the first country that started, and 97 high-income and upper middle-income countries have introduced, and 84% of the low-middle-income countries. About 80% of the doses are, however, administered in only 10 countries. 10 different vaccines at least are out in 4 different platforms. Of course, adding to the complexity of the administration in immunization programs. 4 of them are emergency use listed by WHO, and there are more in the pipeline. For example, the Chinese vaccine Sinovac and Sinopharm that we hope will get EUL in the next, in this month that comes, the next weeks. Next slide. The DG of WHO has been very vocal about the importance of equity and is actually calling the rollout a moral catastrophe. The inequity is startling, as I was saying before. But 100 days from the beginning of 2021, we have actually reached our goal to reach at least that almost every country of the world who wants to introduce these vaccines have access. And the mechanism stood up to be able to do that is, next slide, is the COVAX. This one is the global rollout. And as I said, this is outdated data already. In only 4 days, the number of administered doses worldwide has risen from 704 to 832 million doses administered across the world into 200 economies and territories. And it's only actually 20 countries who've not started vaccinating with COVID-19 vaccines before. And next slide. So COVAX was built to be able to rewrite the map that you just saw, to make it a more equitable distribution and make low-income countries introduce at the same time as high-income countries. So from 24th of February, the first batch of vaccines came out from Ghana, and since then have been rolling out at a very fast speed. Next slide. And here is the map of the COVAX shipped doses. More than 40 million has been distributed to 113 participants and 54 low and low-income countries. And actually 30 participants of COVAX have been able to start vaccination due to the COVAX doses coming into the countries. The yellow ones are where the COVAX the doses have been distributed, but adding another 11 countries. And then in the blue parts is where the vaccination has been started, either by bilateral deals or donations. What we're trying to push a lot in COVAX is to totally change this map and have the number of doses also administered in equivalent numbers as high-income countries. And so there's a fast and rough advocacy for donation of doses, but there is also work within WHO and trying to support lower income countries to be able to speed up manufacturing with transfer of knowledge and capacities into other regions of the world. Over. Next slide. And so here is the stark inequities. The different gap, the equity gap between administered doses per 100 population is about 137 times now between high-income countries and low-income countries. Next slide. And the different vaccines that are now out, the majority of them are from the AstraZeneca or SII, but also the Pfizer doses. You have all heard about the safety signals from the viral vector vaccines, AstraZeneca and Janssen the last week. And it is a worry, and the trust in these vaccines is really crucial for us to be able to manage and help support the end of the pandemic. Next slide. So here are the main concerns that we hear in the COVAX from the different countries, and I know you hear as well. There are a number of areas, both administratively, number of doses to be used in each vial, multiple doses being used at the same time in the same country, which is a complexity in the administration of it, the training, the cold chain differences in equipments, etc. And just the large volume of what we heard before as well, taking up space in the fridges, taking up the healthcare worker time, etc., for and pushing out the capacities for these resources away from the regular programs. Safety signals from the AstraZeneca, the access to vaccines in humanitarian settings. The operational funding is a big worry as well, to have the funding in place when the vaccines actually arrive, and the importance of the EUL for the Chinese vaccines and many of the others to be able to diversify and increase the volume that what could be sent out through the COVAX facility. The vaccine hesitancy and the shipment is also a main concern from many of the countries, and something that is, of course, keeping immunization programs very, very busy at the moment. Next slide. So let me go back to where the last session was. Of course, I work in immunization in WHO, in the EPI program. I'm a pediatrician. I care about what happens with routine immunization at the same time. So very early on, mid 2020, we made several surveys about the impact and could see a stark decrease in the in immunization services. Next slide. However, and we repeated that now to see that the disruption has decreased from about 60-70% to about 30% of the reporting countries reporting disruptions in immunization services. But that is also across the board with many other services that serves children. Next slide. And next, you can go 2 slides ahead. Not this one here. What we also really worried about was the disruption in the planned immunization campaigns across the world. So here you see the map with 66 countries that postponed or canceled immunization campaigns of all the different antigens essential for child health in the first months of the pandemic. Next slide. We could see that now in December 2020, many countries have reinstated immunization campaigns. Mostly affecting now is the polio, but mainly measles, and that's the big care that we all know is a stark danger for for child health globally. About 160 million children are still, or target population are still affected by these canceled immunization campaigns of the different antigens that you see here. Next slide. Here is the map from March 2021. What is the good news is that many who have reinstated immunization services, yes, I'll stop in a minute, is also going back and doing it in a more efficient way, giving several antigens at the same time. Next slide. So here you see the dip that we saw globally in April, May, but it has actually increased. This is the number of doses administered in 2020 compared to 2019. And you can see the increase across the board in different regions and how extraordinarily resilient Afro actually was. Next slide. Next slide. Same thing with them. And this is the last one I wanted to show. I mean, the importance for the future of what the multiple effects of this pandemic will have on child lives and immunization is really about everyone's effort to stop the pandemic and stop it now, not only with immunization, but with every different social measures we can take, the epidemiology, the treatment, the diagnostics, but also the immunization of equitable distribution of COVID-19 vaccines. What we work on a lot now is maintain and restore immunization programs through advocacy, through guidance, but also take the opportunity of the COVID-19 vaccine rollout to invest in cold chain investments, to invest in healthcare worker trainings, the digital tools that are now being used, safety monitoring that is expanding that we didn't see before, And also the trust. Everyone's mind is now on immunization that will help stop the pandemic. That trust in vaccine can be translated into better immunization services later. And then we do need to focus on the zero-dose communities, as I said, and the global health security, which is probably going to be increased when everyone understood what a pandemic can do to both child health and to our economies around the world. The last part is the immunization agenda, where it's mapped out very much a new vision and strategy for the world, with key activities that can be implemented at all levels of the world in all countries. But I'll stop there and give the floor back to Anna, our moderator. Thank you.